right, next we have Kelly Allen, and she'll explain what a navigator is and what they can do to help an individual select the best plan within the Affordable Care Act in the individual market.
Okay, so thank you. I'm Kelly, like she said, and I work with the West Virginia Healthy Start Navigator Project. We are out of West Virginia University, and Navigators were built into the Affordable Care Act. We're part of the law. They're required to be people on the ground in every state, just knowing, you know, when everybody talks, this is a really complicated process. There's a lot of political rhetoric floating around, so we kind of have three primary duties year-round that I think of. We do outreach, so we tell people like, hey, the ACA still exists, and we do that all year round. We try to do a lot of education with helping people know what's covered in their preventive services, know where to find a doctor, know when it's appropriate to go to the emergency room and when it's better to go to a family doctor. So these are kind of maybe the long-term things that are going to help, well, before this year, that we may have thought would help stabilize the marketplaces a little bit better. And then the third thing we do, and what we're really doing right now during the enrollment season, is actually meeting with people one-on-one and helping them enroll in coverage. So we help people with anything related to the ACA. So we do Medicaid applications, we do CHIP applications, the Children's Health Insurance Program, and then the bulk of what we do is the marketplace applications. So we'll meet with people, kind of talk them through what they qualify for, help them do that application, help them estimate their income. That can be really complicated for people in the individual market if they're self-employed or, you know, working part-time, or, you know, their income kind of fluctuates. So we do a lot with that. And then actually helping people select the plan that's going to be the best for them. You know, we kind of get into the weeds of chronic health conditions and medications and prescriptions and physicians, and kind of help them figure out what's going to be the best for them. So that's pretty much what we do. We cover the northern 29 counties, so north central West Virginia and both panhandles. There's another Navigator grantee that covers the rest of the state, so we are in every county. We can help anybody in the state.
Thank you.
Did you have any more questions? I have like a lot of points that I want to make, if that's okay.
How can you help with the intricacies of the ACA plan?
Your mic is.
Oh, yeah.
Oh, sorry.
Why don't you repeat the question?
I can repeat it. Yeah, she just had asked about the intricacies of the marketplace plan. So all of our staff went to a training earlier in October that the Insurance Commission put on, where we kind of got training on Highmark's plans and then Care Sources plans, which is the other company in 30-ish counties in West Virginia. So, and like I said, you know, we try to really learn a lot about the person's financial situation, about their health situation, just kind of make sure that we're making sure that their physicians are in network with whatever plan they select, and you know, talk to them about affordability and make sure that it's something that they're going to actually be able to use.
What kind of paperwork do people need to bring with them when they enroll?
The most important things that people need to have are social security numbers and birth dates for everybody in the household, something that's going to help us estimate their income for the same year or the next year that they're buying coverage for. So if that's tax returns or pay stubs, if you have an email address, you should bring that with you and make sure you can check it. But really it's just kind of household and income documentation that will help us. And if you're offered coverage through your job, typically you're not going to be offered subsidies on the marketplace, but that's something we can help people figure out too. If they, you know how much their coverage costs through their job, and we can help them find out if it meets minimum value requirements and if it's affordable.
And please share with us any other
Okay.
bits of wisdom you have as a navigator.
So I really think it's really important to strike the balance between, as you know, advocates for the Affordable Care Act and activists in the room, that we should be pretty hair on fire about what's going on with the administration and Congress and efforts to undermine the Affordable Care Act. But on the other hand, I think it's really important for people that need insurance or who have marketplace coverage right now to know that for most of them, absolutely nothing is changing in 2018. Cost sharing reductions, although they're not being reimbursed by the federal government, the insurers are still required to offer them. Premium tax credits are still going to be offered. I'm getting calls from people that think that subsidies have gone away, that think that the ACA has been repealed. So it's really important that if you're in that 85 to 87% of West Virginians who qualify for financial help, and I mean that's a pretty substantial amount of people. A single person can make about $48,000 a year and qualify for these subsidies. A family of four, about $98,000 a year. So it's really you know, a big percentage of West Virginians. So anybody that's in that group that qualifies for financial help, as premiums go up every year, the subsidies go up too to keep your coverage within an affordable percentage. So if premiums go up and your income stays the same, you know, your subsidies are just going to lift out to match and make sure that the plan is still affordable for you. So I think that's really important for people to know. We already highlighted that today is the opening of open enrollment, but it ends on December 15th. And I would advise that nobody wait until December 15th to sign up. I've experienced a lot of crashed websites and jammed phone lines in my day. And in past years, the Obama administration has extended the deadline a few days for people that couldn't get through. We don't know if that's going to happen this year. So I definitely sign up sooner than later. And I did want to also mention that the IRS did announce last week that they are going to enforce the penalty in the spring when people are filing their 2017 taxes for people who are uninsured. So there have been some waffling on that, but the latest information that we have is the Affordable Care Act is still the law. There is still an individual mandate, and people will still be penalized if they go without coverage. And also, just to add something to that, another thing that we do is we do help people file exemptions for the penalty. So if you truly cannot afford to have health coverage, we can help you see if you qualify for an exemption. If you have issues with the marketplace, we can help people do appeals. So we try to be really full service and be helpful to people year round. And then I think that's really it. Did you have any other questions?
I don't have any other questions.
Okay, cool.
Thank you very much. That's a lot of help. I think, you know, when you read about all the different plans that there are and all the different, you know, benefits, I think it would be essential to have a navigator to help. And I know I mentioned it before, but I'll mention it again. There's going to be an enrollment session on Saturday, this coming Saturday, at the Judge Black Annex, which is just next to the old courthouse, from 10 until 7 p.m. So pass the word, you know, spread it around to your friends and neighbors or people who may want to take advantage of that, because that could be really helpful.